I give my thanks to the AIOC to give me this opportunity to represent this one. My topic is the dry eye syndrome in diabetes mellitus, prevalence and etiology, pathogenesis, clinical features and preventive and treatment strategies.
Literally, you have to rush through the slides.
Diabetes Federation report 2013.
Yes. Literally, you have to rush through the slides, yes, because I am getting constant
number of the diabetes mellitus patients in India is 65.1 million. And though the diabetic retinopathy and cataracts are well-known complications of the diabetic patients, dry eye syndrome is also common in the diabetic populations. And prevalence of the dry eye syndrome in the diabetes is 15% to 33%. And incidence of the dry eye syndrome in the mild NPDR and moderate NPDR is 17.1%, and severe NPDR is 11.1%, proliferative PDR is 25.1%. Diabetic retinopathy is associated with the decrease in the tear film functions. In diabetes, there is an increase in the corneal fluorescence scoring state, positive rate of the rose Bengal staining, surface regularity index, and surface acidity index. And tear breakup time, CMAS test, these are decreased. And dry eye syndrome is characterized by the lacrimal functional unit dysfunction, and lacrimal functional unit protects and maintains the tear film and normal function of the ocular surface. LFU plays a regulatory role in the tear secretions, tear film formation, and maintains the normal physiology of the ocular surface. Damage to any component leads to the tear deficiency and irreversibility of the dry eye syndrome. Effect of the hyperglycemia in the diabetic patients on any component of the LFU may be mediated to enter the neural connections, lead to insufficient tear production, excess tear loss, abnormalities in blinking, and changes in the tear film compositions. Corneal complications in the diabetes mellitus caused by the hyperglycemia includes the superficial punctate keratopathy, tropic ulcer, persistent epithelial defect, and recurrent corneal erosions. Abnormal enzyme metabolism. These are polyol pathway is triggered by the high glucose level, leads to activation of the aldose reductase and accumulation of the sorbitol within the cells, and they lead to the cellular edema and dysfunction, which leads to the lacrimal gland structure damage and induction of the decreased tear secretion. There's a decreased mucin secretions. Diabetes causes the corneal and conjunctival epithelial damage, reduction in the goblet leading to a tear film instability. Diabetic neuropathy is an important risk factor for the lacrimal gland dysfunction. Autonomic control of the lacrimal gland functions may be compromised by the neuropathy of the diabetes mellitus. Dry eye syndrome is particularly common in the patients with diabetes mellitus complicated with the polyneuropathy. Tear film dysfunction, tear lipid thickness stability, corneal sensitivity, tear quantity are significantly decreased in diabetic patients. Risk factors for the diabetes associated with the chronic hyperglycemia, diabetic peripheral neuropathy, decreased insulin level, microvasculopathy, and systemic hyperglycemic disturbances. Inflammation and immunity play an important role in the pathogenesis of the dry eye syndrome. It is immunoinflammatory regulators are identified as a MMP9, immature antigen presenting cells, CD4 plus helper T cells, and interleukin 17, interleukin 1A, 1B, tumor necrosis factor A, and metalloproteinase 9. Symptoms of the gritty sensation, soreness, decrease of the visual acuity, photophobia, itching, visual impairment, corneal scarring, and the ulcers. Early diagnostic treatment of the dry eyes are artificial tear, anti-inflammatory drugs, that is the corticosteroid, NSAID, tractolumia, cyclosporine, autologous blood serum, and drugs under the clinical trial is the chemokine receptor antagonist, that is tofacitinib, LFA1 antagonist, that is rifampicin, and P2Y2 receptor agonist, that is diacofosol, and recombinant human serum albumin, the RU101. In summary, increasing prevalence of the diabetes mellitus associated DES has been reported in recent years. In addition to tear consent, which is leading cause of the blindness, more attention should be paid to the DM and diabetes mellitus associated dry eye syndrome, the most frequent diabetic complications in eye disorders in clinical practice. Thank you.